Hello, my name is Dr. Dewan S. Raja. Today I will discuss about skeleton of the foot. First of all, we'll go to the anatomical position. The foot has plantar surface and the dorsal surface. Plantar surface is concave and the dorsal surface is convex. The talus is the highest bone of the skeleton of the foot. This is the talus. Okay. Then the trochlear surface of the talus is directly directed upward. This is the trochlear surface directed upwards. The sustentaculum tali is here. This is the shelf-like process from the calcaneum. This is directed medially. Tuberosity of the navicular bone. This is the tuberosity of the navicular bone that is directed medially. Okay. First metatarsal bone. This is the first metatarsal bone. This is the thickest and the strongest of all metatarsal bone. The calcaneum lies posteriorly. The cuboid bone lies laterally, and it is a groove on the plantar surface here. So if we look at that, okay, so this is our skeleton of the foot. So this is concave. This is the plantar surface. Concave, this is the dorsal surface. This is the talus. This is the topmost bone. This is the calcaneum bone, calcaneum. And this is the navicular bone. And this is the tuberosity of the navicular bone is here, tuberosity. And this is the sustentaculum tali here, a shelf-like medial process of the calcaneum bone. And this is the navicular bone. This is the boat-shaped bone. I can show you here. This is the boat-shaped bone, the navicular bone. Here is the navicular bone. Okay. This is the medial cuneiform. This is the intermediate cuneiform here. Okay. Medial cuneiform, intermediate cuneiform, middle cuneiform, intermediate cuneiform, lateral cuneiform bone. This is the cuboid bone. There is a groove underneath the cuboid bone here. There is a tuberosity on the navicular bone. Okay, so this way we can identify the side. This is the right foot, skeleton of the right foot here. Okay, we got that. Okay, here we got that all. This is the talus. This is the head of the talus, neck of the talus. This is the talus, the trochlear surface. It is a comma-shaped medial articular surface. Okay, and is a triangular lateral articular surface here. This is the calcaneum bone, also called calcaneus. Okay, this is the navicular bone or the boat-shaped bone here. This is the navicular tuberosity here. We have three cuneiform bone: medial cuneiform, intermediate cuneiform, lateral cuneiform. This is the cuboid bone here. And here the first metatarsal, second metatarsal, third, fourth, fifth. These are the phalangeal bones. We have two phalanges in the great toe and three phalanges in other toes. These all are the short. These are all are the short bones. These are the miniature long bone. Okay, this is a miniature long bone. Although they are short bone, but they are ossified in the intrauterine life. These three, the talus, the calcaneum, and the cuboid, they get ossification. The ossification begin during the intrauterine life. Okay, we got that. And this is the plantar view. We have a groove here on the cuboid bone for the passage of the fibularis longus. This is the tuberosity of the navicular bone for the major insertion of the tibialis posterior. This is sustentaculum tali underneath we have the passage of the tendon of the flexor hallucis longus. Okay, we got that. Now we'll go to the component part of the skeleton of the foot. We have the tarsal, these are the tarsal bones. Then we have the metatarsal bone, these are the phalanges. Okay, so we got 7 tarsal bone. Okay, tarsal bones are short bones. Okay, short bones contains the spongy bone surrounded by thin layer of compact bone, and these short bones, they are cuboidal, they have 6 surfaces. Okay, so they have 6 surfaces and 4 of them are articular surfaces. And this is the talus bone. This is very special. This bone has no muscular attachment. Okay, we got that. So we have proximal row, calcaneum and talus, middle row, navicular bone. This is the navicular bone. Okay, so distal row, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid bone. Okay, and we got that cuboid bone. Joint, talocalcaneal joint, that is called talus, and the calcaneum, talocalcaneal joint, this is called the subtalar joint, anatomically subtalar joint. But clinically, talocalcaneonavicular joint is accepted as the subtalar joint. Movement of the subtalar joint, inversion and eversion. Okay, so here we have the bone, again the talus bone, medially articular surface of the talus, the trochlear part. Here on the medial aspect, this is the comma shape articular surface. Okay, this is the neck, this is the head. Okay, and this is the body of the talus. This is the navicular bone, medial cuneiform bone, first metatarsal bone, and bone of the foot makes an arch medially. We call it medial longitudinal arch, essential for shock absorption and protection of structure, and also easy way to movement. Running, walking is helpful by these arches. We have the longitudinal arch, medial, we have the lateral longitudinal arch, we have the transverse arch, anteriorly complete, posteriorly incomplete arch. Okay, this is lateral longitudinal arch. Again, this is the cuboid bone. This is the lateral cuneiform bone. Intermediate cuneiform bone on the other side, just on the side with the medial cuneiform bone. Navicular bone, boat-shaped bone here. Okay, this is called tarsal sinus. Okay, there is the space between the, here is the tarsal sinus here. Okay, space between the talus and calcaneum is the tarsal sinus. Here is the tarsal sinus. Okay, we got the phalanges, metatarsal bone. These are miniature long bone. These are the short bone. This miniature long bone, they have the epiphysis at the head region. Okay, only in case of first metatarsal, epiphysis at the base. Rarely we may have an aberrant epiphysis here. Okay, in case of phalanges, the epiphyses are present here. These are present at the base of the phalanges, epiphyses, the base. Okay, but metatarsal on the head, except the first metatarsal. Here is the epiphysis. Okay, so we got phalanges here. They are also miniature long bone. They have one epiphysis that is at the base. Okay. Okay. Here, radiological view, X-ray view, we must know structure. What is this? This is the talus. This is the calcaneus. This is the posterior border of the calcaneus. Here is the site of insertion of the tendoachilles or tendocalcaneus. This is the sustentabular teli. Underneath we have the tendon. Which tendon passes? That is the flexor hallucis longus tendon. Okay, tuberosity of the fifth metatarsal bone, we have the insertion of the peroneus brevis there, okay, or fibularis brevis muscle inserts there. Also the fibularis tertius muscle. Okay, navicular bone, tuberosity navicular bone, insertion of the tibialis posterior, main insertion. Tibialis posterior has multiple other insertion to almost all the tarsal bone except the talus and first and fifth metatarsal bone. Okay, so we got this X-ray feature. This is the sesamoid bone. This bone forms in the tendon, the long tendons. We'll get that. Okay, sesamoid bone is very common structure formed in the tendon of the foot on the plantar surface, the flexor tendons. Okay, so inversion, eversion of the foot. Inversion, which muscle causes inversion? Tibialis anterior, tibialis posterior. Accessory muscle, flexor hallucis longus, flexor digitorum longus. Eversion is done by the fibularis longus and fibularis brevis, also called peroneus longus, peroneus brevis. Old books say peroneus longus, peroneus brevis. And accessory muscle for eversion is the fibularis tertius. What is inversion? Is a movement in which medial border of the foot is elevated and sole faces medially. Okay, inversion, medial part is elevated and sole is facing medially. Eversion, lateral border of the foot is elevated and the sole faces laterally. Okay, axis of movement for inversion, eversion, an oblique axis that runs forwards, upwards, medially, passing from the back of the calcaneum through the sinus tarsi to emerge at the supermedial aspect of the neck of the talus. So it goes through that. This is the axis from here. Okay, goes there for the inversion, eversion. But we'll go to the metatarsal and the toes. We have the abduction, adduction. That axis goes through the second toe. So anything away from that is abduction. Anything close to the second toe is adduction. The second toe has no, it has both abduction and adduction. You can go this way and that way. Okay. So in case of second toe, abduction, it's because of the axis. So in both way we have the abduction, second toe. For other toe, if it is going away, abduction, it is going close to the axis, then it is adduction. Okay, here is the joint, talocalcaneal joint, anatomical subtalar joint, plain synovial joint. What type of movement? Inversion, eversion of the foot. Talocalcaneonavicular joint, that is accepted as a part of, or this is the subtalar joint clinically. Ball and socket type of synovial joint, compound multi-axial articulation, gliding and rotatory movement. Who makes the ball? Ball is made by the head of the talus. Who made the socket? The posterior articular facet of the navicular bone forms the facet. Okay, so what is the calcaneocuboid joint? Calcaneum cuboid, this is a saddle type of synovial joint that help in inversion, eversion. Okay, transverse tarsal, calcaneocuboid and talonavicular joint help in inversion, eversion. Intertarsal joint, plain type of synovial joint. Inversion, eversion, supination, pronation partly, not like that of the hand, but here also supination, pronation. Metatarsophalangeal joint, ellipsoid. Some books say condyloid variety. We'll accept Gray's Anatomy, ellipsoid. Movement, abduction, adduction. Interphalangeal joint, hinge, flexion, extension. Ankle joint, what type of joint is ankle joint? That is formed by the talus and the tibia and fibula. That is a hinge type of synovial joint. Okay, here is the arches of the foot. So this is the medial longitudinal arch. It has 3 metatarsal coming together plus the tarsal bone. This is lateral longitudinal arch. Okay, 2 metatarsal. Okay, so here pes rectus normal plantar arch in adult person. Pes planus loss of longitudinal arch, flat foot. This may happen to an unconditioned person who suddenly work too much, like a newly recruited hotel busboy or hotel server or waitress. They may have this type of problem. Pes planus may develop, but pes planus may be normal in the children because of the fat pad. So they also pes planus eventually it goes away, but it may be pathological due to sudden lifting of weight for a long time, like that of the waitress in a hotel. Pes cavus, this is increased height of the longitudinal arch. Important. There may be some neurological problem. Okay, so there may be some spinal cord problem. So that may cause like that of cerebral palsy or some other neurological problem may lead to pes cavus. That is called Charcot-Marie-Tooth syndrome that will also cause pes cavus. Pes transversoplanus, loss of transverse arch, that is also possible due to unaccustomed activity that may cause that. And that's all about the skeleton of the foot. If you have any question, please feel free to ask me. Please support my channel. Please share the information with your friend and please subscribe me. Have a nice day. Bye now.